All right, now we'll call the meeting to order. Staff or trustee addition or deletions to the agenda or consent agenda. I know that I have two that I would like to add. It's a presentation by Mr. Mike Peacock and a presentation by Dr. Baird of FGC. Are there any other staff or trustee additions? Then I'll entertain a motion to adopt the agenda.
So moved.
Second.
Got a motion and a second. All in favor, signal by saying aye.
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 All opposed, motion carries. Public comments, Ms. Lindley.
Good evening, board members, Director Williams, and Board Attorney Fred Coberline. This board and previous boards knew in April 2020 that Community Health Systems was leaving Lake City in the operation of the hospital. In September 2020, that was 2 years ago, almost 20 months. And we're finally attempting to do something again with these buildings. Maybe something will happen tonight. And it was in operations and meetings were held with Zoom, thanks to Carl Lynch, and I certainly hope they continue. This board was reduced to 3 members and a board member was appointed. However, I feel this board is not a legally constituted board. And I don't know, why is this board afraid to ask the board attorney to get an expedited Attorney General opinion on the legality of this board? Do you have any response as to why? Why is the board afraid? Is it afraid because they know the answer? This is not a legally constituted board. The enabling legislation states that one board member will be a practicing physician at the hospital. And this is not possible because there is no operating hospital, and it appears there will never be an operating hospital. And if you're not aware of the process to get an Attorney General opinion, I can't ask for one, but you can, and it comes through the board member. And I suggest, and I asked, maybe Director Williams can say, maybe you guys need to get an opinion. But this board continues to spend $85,000 a month for vacant buildings. And that's a lot of money. And currently, according to the information in there, there's only 60 active clients. And I just think something needs to be done. Maybe something will happen tonight. And I hope you guys will consider asking for an expedited AGO opinion on the legality of this board. Thank you.
Thank you, Ms. Lindley. Mr. Wilker.
Thank you, Mr. Chairman. I've been covering Lakeshore Hospital since about 2006. And 60 clients is certainly something amazing. There was a time when the hospital authority had over 1,000. Didn't have an executive director. She did all the work. And now we're down to 60 clients. And we still have an executive director who comes to work when he wants, which is pretty cool. I've received information from the Florida legislature today that they're in favor of Dr. Barrett's plan. At least some members are. That they think it's a good plan, that they think it would be good for Columbia County, and that they think it's a win-win situation for everybody. I haven't heard why, and that'll be presented later, why it's not a good plan. I agree with what Ms. Lumley said and what I've been saying for months. If you do not have a legally constituted board, but you do have an attorney that wants to be a judge, and why you guys have never asked this opinion of the attorney. I mean, you don't even need an attorney general opinion. It would be nice to have it,
Yes.
But you have your own hospital authority opinion, a whole hospital authority attorney who charges you folks $160 an hour. Actually, he charges more because he charges to think about the meeting. I think what is it, like $1,200 a month now, or $1,500 a month, $750 a month. I can't remember, but he charges you guys just in case, I guess maybe in case he wakes up and has a dream about the hospital authority. That must be in his arrangement with the authority. Nobody does that generally in general government. These kind of things. Very few people that can, very few. Limited. So we've established that you've got 60 clients, that you have a part-time executive director who's now doing, I guess, the same amount of work that somebody did who was an office employee when there was 1,000 people, refused to get an attorney general's opinion. And now tonight, you're gonna have a presentation, which I already heard, part of it anyway, maybe it's been modified since then, which various members of the legislature think is a win-win situation. I'm sure the governor would, because he supports this kind of thing. And my understanding is that Gail Williams, and he can speak for himself, doesn't want to give the hospital away, wants to lease the hospital. I don't know if that's true or not, but maybe he could help us out on that, because obviously if the hospital authority is leased, then he can still have one of his many consulting jobs that he has throughout the county and the region. And I'll take, when I sit down, you can.
I suggest that whoever told you that,
When I-
you just need to go back and revisit with them, because I've had no such conversation.
Yeah, okay, well, that's fine.
Well, you just pulled that out of thin
I
air.
know I did, but in
Yeah,
any
you
event,
did.
there's no reason anymore for the Lakeshore Hospital Authority to own that hospital. Been vacated. I can't remember when it's been vacated, it's been so long ago. Started out costing over $150,000 a month to keep it empty. And now I see the average is $80,000 a month from the information that Gail Williams gave to you guys. Time to put a break on that. So I'll be curious to see what you guys do today. And if you don't have an attorney's opinion on whether this is a legally constituted board, maybe you should ask the man who intends to be a future judge to write you one. And then we'll see how that opinion stands up. Thank you very much, Mr. Chairman.
Thank you, Mr. Wilson. Any other comments from anybody attending via Zoom? None, I'll entertain a motion to approve the consent agenda.
So moved.
Second.
Got a motion and a second, all in favor, signal by saying aye. All opposed, that motion carries. Move down to new business and we will start with the additions. Mr. Mike Peacock.
Thank the board so much for allowing me to come in this evening to short notice. Basically, what I was looking at is what you all have on with the health improvement plan and what our organization should do. Give you a little background about our organization. We own several detox facilities, long-term care facilities, as well as clinical infectious disease facilities from Jacksonville to West Palm Beach, out of the state of Florida as well, close by as Madison also. I'm one of these people that believe in working in collaboration with individuals and working in collaboration with municipalities and organizations. I just found a good friend of mine who just met on school, and he just basically stole my presentation I told him a few minutes ago. But I think that a lot can be accomplished. I'm not going to hold up a lot of your time right here, but definitely the goals that need to be met right now, strategic. About access to care, and not going to tell you all that there are access to priority mental health services. Those are my area of expertise, and we've done those for thousands of people throughout the South Florida area as well as Indianapolis. And I can tell you that the campus that you have here now can be utilized, and I'm going to hear the presentation behind me that I've had a chance to look at as well. And without knowing as much as I would like to know at this moment, I'm not going to go into a lot of detail at the moment because I think there's a big opportunity for collaboration here. And that's the way you do it. I mean, that's just what it's all about. And I just, again, want to let you know we exist. We're very interested in helping you all ascertain these goals. Should I say, compete them for you? One of the big things about our organization when we do work with municipalities, we don't deal with a lot of change orders. We like definite timelines and try to meet whatever we say we want to do. I mean, we try to meet those immediately. And yes, up to the board. I thank you all for the time to have, and I'm gonna let my friend who's got more of my presentation come up here and do his part of it. And if there are any questions, I'll definitely take at this moment. Questions about it.
So you submitted a proposal.
Yes, what we did in the beginning, we submitted, I think you only have it, I don't know if you have it or not, it was late. When we did it, because we want to revise it. What I did, I was able, after we submitted the initial proposal, we were able to employ an individual that we had been seeking after for a while. Very renowned individual in the healthcare community. His name is Derek T. Paul, and I can get more information on him. Matter of fact, he's recognized by Forbes in 2019 for leading organizations. Things similar to what you all are trying to accomplish right now. And I said, okay, wait, let us read it. Submit it. I think you all should have a copy of that in the position. But after meeting the local college here, I mean, I think we got some things in common that we can work together on and just make the best out of it, pool our resources that we have to bring to the table, because we do have resources as well, financial, and of course our expertise, because we are a private company and we do have a nonprofit side, which would be the nonprofit side of working here as well. We are motivated by getting services to individuals as well as fiscal stability overall, and of course, profit as well. I mean, there's no doubt in what we do, but like I say, it's my first opportunity to meet gentlemen, and I think there's a lot of collaboration that can be done right here. I believe to accomplish right now on speaking about what we were doing individually before, finding out what other things are on the table. I wasn't aware of it, but I'm very excited about it, and I think we can definitely reach those goals that are mandated by 2023. Again, I thank you all so much time to allow me to come at the last minute. I apologize.
Any other questions from Mr. Pico?
Again, what is the name of your company?
Okay, our nonprofit is First Coast Community Development out of Jacksonville. It's downtown Jacksonville off Union Ocean. We've been in business there for 5 years. What we do down there, we house, feed over 170 veterans daily. We have over 600 and some beds at our housing locations down there, which we took motels to revamp them and that's one of the key entities that we try to take care of and reach out to. I'm also working directly with Bob Astos out of Tallahassee with the Veteran Affairs Office over there. He's the lieutenant colonel of that now, but we're trying to get veterans that were incarcerated that had mental health and dependency issues and everything placed in our facilities. One of the ideas that I had over here to work with veterans outside of it. That's my little passion. Of course, and it's just as easy to take care of those individuals as well as the rest of the community if you got the services there to entertain individuals in the community as well, especially the underserved individuals, especially with its demographic location.
Okay, now the way you're talking, it gives the impression that you would house everybody. What if they are housed elsewhere in?
Oh, no. I mean, literally, like I said, when we initially looked at the project over here, it went from looking at bringing veterans to the larger part of the facility here, of course, okay, house them, treatment, services. But now with newfound information and how we could actually, reach the goals that need to be reached over here. I mean, we're open for changes and everything, so don't, put them to the cross one day right now, because I'm learning
No.
more every day.
The reason I'm asking is because our VA hospital has a large number of
Yes, ma'am.
in-house patients
Yes, ma'am. All of
that
it.
could do with extra treatment.
Yes, and I literally just got off the phone with the person that's over the entire state of Florida VA. It's a Florida VA and it's a federal government VA. I've had them petition along with Bob, excuse me, with a couple other senators and changing the referral process and everything else for veterans to get services outside of the VA. That's the problem right now. They're not being served. I got numerous cases. I'll share it with you. I mean, it's just ridiculous. I get deterred every time I look at it. So here's the solution to it. Let's work with other organizations like what we're doing here, that VA qualified facilities, certified facilities that can service these individuals, whether they're in-house with us, whether they're in the community coming over. My goal and what I would like to see, especially working on collaboration with locals here, we could be, and I know this sounds very ambitious, but I don't see why we can't. This could be the little miniature style Gainesville, like they're running competition with them, because you've got a lot of veterans from Tallahassee, Jacksonville, right now, 6 months, 10 months out right now on getting in. I mean, the veterans in here right now tonight, but you got a lot of them right now just waiting on every service you can possibly think of. If you bring behavioral health, you bring primary care, you bring hospitalization, everything you can right here, and that's, you're talking about bringing a lot of resources right here where we're standing at right now. I mean, it's just, you can't see that, it's blind. I mean, it's just that simple. And if you can't see it, I don't want to be a part of it. You gotta be able to see it, because veterans are important right now, because they're, that's it.
We also have people from South Georgia that come to this VA here.
Yes, ma'am. They cross line. You're right about that. You're thinking exactly. Well, I'm about to get me another collaborative partner. I'm telling you, you're thinking just like I'm. That's exactly what I see. It's impossible to fail. If you move this the right way. You would definitely you have the support of the Veterans Court. I've been working with them as well out in Tallahassee, Judge Aikens up there, and he's got 30 people or better, 40 literally sitting in jail. It's not because you put them there, but the thing is they're waiting on what they call a VA referral, and you have to wait, and that's the bottleneck with the VA. And I'm working on that. I'm literally working on that now, legislation and everything else. But you've got to get that bottleneck out to where these veterans can go out to other individuals, other entities to get services. This area here, this could be, I hate to use all kind of terminology, just to be the Disneyland for it. This could be it. It could be just that big. And at the same time, meet the needs of the community. This community right here, the underserved area, I get a chance. And it's so weird. I'm not trying to say long winded here. My little daughter gets her hair done over here. And that's the only reason normally I have to come over here. And I get the task sometimes to sit there for 6 hours and wait. So I would drive around and look, and I would have a chance over the last couple of months to just see what's going on with it, especially like I say in underserved areas. Yeah, there's some changes to be done. And I think, working with the local community, we can do it. No doubt about that. And service them, be an asset to the VA facility. We're not in competition with them. I mean, they need it. I mean,
Yeah, they do.
Again, I think you go. Any more questions? Thank y'all so much. I appreciate that.
Thank you, Mike.
Oh,
Mr. Chairman, just for point of clarification, you do have by separate handout a copy of what was submitted, and I logged it, Mike, under Haven because that was the way it was received.
Yes, and that's when I was in companies. That's when I was for profit. One of the for profit.
But
To a large organization.
it was received by email. It was not received by standard mail, so it was not included in the materials. It is one of those proposals that should you wish to consider it further, you would need to accept. I do not have the authority to accept it because you would have to declare that was an informality and then log it in. Just want to make sure you understood that.
excuse me, you would also, would you share that, pass that little brochure around right there? And I'm
I
sure
will,
that'll show
yes.
you the type of facilities that operate and run.
Thank you.
Thank you all so much.
Dr. Barrett? Just a second, I think Carl's gonna give me a hand on this.
Okay.
So we can get.
Well,
this-
before I begin, I just want to thank Dale Williams for letting me do this at the last minute when I called on Friday, and thank you for the board for letting us, letting me present to you this evening. And I also want to clarify, I'm sure Mr. Williams will clarify it, I did not submit a formal proposal. So this is kind of a last minute request that the college has made. And that before my board of trustees on Thursday, in a presentation with them, and they had agreed for us to talk about our potential interest in Lakeshore Hospital building. I'm clear that I don't have formal presentation, a formal proposal out there. I do have a handout of my PowerPoint. Up here.
There's a seat right here.
Have to do from there, or can I do it from here?
You can trust. But, tell me when to-
Okay, so this is the Lakeshore Hospital property. This should take about 7 or 8 minutes. I welcome any questions during the presentation. You want to go to the next slide? So as I talk about this, it's the repurpose, renovate, and revitalization plan for Lakeshore Hospital building. And when I talk about this, I talk about the hospital building only. And I call it for purposes, this meeting, the Florida Gateway College downtown campus. There's lots of short-term and long-term benefits. You can click down to all of them. All right. To me, it would change the downtown community, the college feels. This campus facility would act as a catalyst for additional development for the Lake City downtown area and Columbia County. There'll be a significant economic improvement for the vicinity of the building, and the college and the community would benefit because we would increase and expand healthcare programs. Adaptive use. The lake provides, and the building provides an iconic initial impression for prospective students, visitors, and community members. The current facility has adequate parking for an additional campus. And research also indicates that we'd be the first college in the state of Florida that would repurpose an old hospital building into a healthcare training facility. The building's internal layout is really important as we looked at this, if we were going to move forward with an interest, because the different elevators allow access to different types of roles, different roles for community partnerships, different roles for student faculty, and et cetera. Those 3 different elevators could be controlled that way and would elevate us to be able to have a safe and secure campus by doing that. All the FGC health programs would move to this facility from our current campus in Lake City. That would include our health information technology program, which is the electronic records program. All our nursing degrees that run now from CNA up to our bachelor's degree in nursing. It would also house our physical therapy assistant program. Enrollment. The building would allow us, our current facilities at 29,000 square feet on our campus. With the building, as you know, it's about 99,000 square feet of usable space, the hospital building. Our first year enrollment without any expansion would be 425 students. It would also allow us to expand for additional healthcare programs, and it would allow the downtown to have 425 students here Monday through Thursday and faculty. which would be an economic boom to the downtown area. These are some of the new program possibilities that we think about immediately out would be respiratory care therapy. As we all know, with the COVID situation, respiratory therapy has become a huge need in healthcare across the United States. Radiography, we've already been looking at radiography, and basically the Surge Tech program is a needed program for hospitals. In the region, they're very small programs with only about 12 students admitted each year, but the other two would be much larger programs. The wing that currently houses the hospital cafeteria, if you see as you look from the lakefront, and many of you ate there through the years for discounted price for a good meal, we would adapt that into our hospitality program. We think that that could be adapted quite easily with the 2 conference rooms off the kitchen, which would act as traditional classrooms, and then the actual dining room would be for training and culinary. The kitchen would be adapted for 16 ovens that are done for basically for training for culinary arts. Next. There's also potential for a healthcare academy or a charter school in that facility, depending if we wanted to look at that. So I called it both the FGC Healthcare Academy or a healthcare charter school for high school students. Partnership opportunities. This is where we talk about partnership opportunities. College would see the facility is primarily a college campus. However, the first floor, other than the hospitality wing, would be an ideal place to do partnerships as we see fit with healthcare or healthcare establishments. Going back to what the mission of the Lakeshore Hospital Authority is for underprivileged care. Partnership potentials, lots of opportunities. This is very early in the discussion. I heard a presentation earlier. We would see that one of the areas we thought about would be an urgent care service for indigent individuals. We wouldn't see, at least remember, this is all us just general information. We would not see that this would be a hospital and then a college within a hospital. We just don't see that as potential, but we'd be open to hearing that. We'd also see this facility as a general partnership with outpatient and inpatient medical providers. And then we have other adaptive uses that potentially could be used for the facility. As you walk in the main entranceway, to the right is where the executive offices were. And like that area with the computer technology area, we see that as a potential business incubator for potential business students that could be trained in opening their own business, small businesses. If you know about incubators, there's a lot of potential where you charge people very little money to try to start their businesses. And all of those services would be integrated with the college. So if we get healthcare providers, we would hope that our students would get to be in clinical spaces in the healthcare areas. And also if we ever talked about incubators and so forth, we would talk about those for business students. How would this work? We would propose the hospital would donate the hospital building to the college. The reason for that is that to receive federal and state grants, the college really needs to be the owner of the building or our foundation, which I have Mr. Pinchot, the executive director of Florida Gateway College Foundation, here with me tonight. The college would seek repairs to the current building from the authority or seek other opportunities for $10 million. We've looked at that. And then the college would seek federal and state grants for any renovations that would involve what I would call facility repurposing, which we have had an engineer look at that to look at moving walls and so forth that could accommodate a college environment. Then questions. I think I went through that pretty quickly, but wanted to be succinct about it. Are there any questions? And remember, this is very, very early for the college, and I know I thank you for letting me do this. And we would submit a proposal if I knew it was late and past the deadline. So I'm not sure that it's possible, but we were going to give it a shot.
Any questions for Dr. Barrett?
Yes.
There's no rent, it's all donation.
Yeah, that's what we would feel that because based on the needs of it wouldn't be a rent We wouldn't actually entertain renting the facility for the Lakeshore Hospital because any grants or any federal or state grants we would get require ownership from the college. That's a requirement for, let me use an example. When we did our Lusky project with the federal government, we had to show them we own title ship in order to get that CDL grant of $2.5 million to do that. The federal government would never entertain us having a leased facility and giving us that money. That's the kind of situation for educational institutions. I don't know about others, but that's the way that was the entertainment because we thought it was the best case scenario. We're willing to discuss that, but I mean, I just wanted to let that know.
Well, we've still got electric to pay and stuff like that then.
No, I'm talking about actually
Transfer.
the transfer of ownership, so we would take over the utilities and so forth, once that transfer occurred. It would not be that it would be a college-owned facility.
I have a question here in the back.
We'll
You get to us,
yeah,
Benjamin.
later on that.
Okay.
Do you need classrooms for the nurses? Do you have
Yes.
classroom
Yes, we
facilities in
do.
there?
Yes.
Okay. I didn't know if there was actually, auditorium type spaces in there.
No, it actually, as we've looked at the inside of the hospital itself, for our engineer, we thought actually, it's a base, don't ask me, I'm not an engineer. But
Yeah.
all those walls that were concrete, we thought were load-bearing walls are actually held up by just columns through each of the buildings. So you actually can take out those walls and adapt it.
I'm an accountant, so, so you're saying that you would like the hospital transferred to the college. You would, take over the operating expenses. And then, you said you would come to the authority for $10 million in renovations?
Well, actually, we wouldn't take ownership. We would have a legal description, as Mr. Fiegel would say, is a give back if those things weren't done and so forth, the reverter clause and those things. But actually, the issue is, let's cut, I'll cut to the chase kind of on these things, is when other organizations came before you, the only difference that other organizations say, well, we need $6 million of free rent for you for the next 5 years. What we're saying is, in order for us to entertain this, we would need ownership of the property in order to do that. Because
And do you have to have absolute ownership, or could you accept a long-term lease?
according to, if we rent for some of the federal grants we've gone to, $1 leases for 40 years wouldn't count. But there's others, I'm not saying all of them, but the ones we recently did require total ownership for the college, and they wouldn't go along with the lease. But I can't say all of them. I can just say the ones recently we went to.
Okay, but would you speak to you mentioned $10 million?
Our understanding, after reviewing it with some of our engineers, after doing tours and stuff, that to fix the roofs and the skin of the building and some of the HV, the repairs are about $10 million.
Okay, so would you want to do those renovations, and the authority would make a
We could do,
contribution?
it's up to, it would be solely at the time, if you wanted to do it prior to ownership or moving towards that, it would depend on what the agreement was. Very early discussions, if you would even entertain that situation.
Writing thing sounds good to me, like say I'm an accountant, is taking over the operating expenses. So,
And quite frankly, that's the part that scares the college out of anything, is not so more of the renovations, is because if we move forward with any of this, we estimate that the operating cost per year would be an additional $2.1 million on our budget. And for somebody that got only about $8,000 as of Friday, I think we've gotten now $300,000 in our operating. We're already $4 million beyond the usual amount that colleges get our size. That worries us. So we would be requesting state authorization from some of the legislature in order to get a special ask to have operating dollars forever to operate this campus. But with the healthcare initiatives that are going on in the state right now, and monies if there's ever been a better time to do that, would be to try to leverage that.
You feel confident, not real sure that they would?
I think it's like the chicken before the egg. I mean, if the situation was, if there's any interest, then we would immediately start some lobbying efforts and so forth. But if there was no interest, I just can't say I'm gonna want 2.1 million and not have any kind of talk.
Uh, 425 students, how much staff do you think you'd be bringing?
We're looking at 8 FTE for
Mhm.
this facility. So we're looking at a director, an assistant director, 3 facility staff, and then an additional 3 faculty coordinators for the program. So 8 FTE.
Okay.
And that would bring also over currently the 17 or 18 FTE we already have, and for nursing staff for all those programs. Don't quote me, it's anywhere between, it might even be a little larger.
All right.
Dr. Barrett, briefly on your vision for the private partnerships, could you elaborate a little bit more as to what your vision is for that?
I would foresee it as, we've talked about this quite a bit. We would try to seek out, as I mentioned earlier, I don't think that would operate as as an emergency room. I think it would be considered a much more urgent care, but it would be a different type of urgent care. If you've seen some of the urgent cares, the doc in the boxes are being bought by the bigger corporations for profit. We would probably seek out a relationship with a doctor or a nurse practitioner that can practice and start trying to look towards that kind of a situation where the engineered care would be for bringing in people for mainly more of urgent care issues and so forth like that. That's our vision, but we're open to other potential, some of the other potential people that have talked to us are more for profit people, but I think, keeping to the mission of what this organization is, we would like to try to do something for the engineered care also to meet those needs of what your mission is, if you would ever consider what I'm asking you to do tonight.
And the current healthcare degrees that the college FGC currently has are?
Currently, we are redoing CNA. It starts in the summer, whether this happens or not. CNA, LPN, ADSN, which is the Associate Degree in Registered Nursing, Bachelor's of Science in Nursing, Health Information Technologies, which is electronic records, Physical Therapy Assistant, and we would probably also do some work on paramedic, even though that's offered at the Ulusty campus. There's some need to do paramedic and EMT training here also. And we see that as potential of using that facility as a working laboratory with for-profits or nonprofits and so forth.
And your current student enrollment for those programs
425.
Currently now?
That's why I said, so those other programs would add about 70.
What percent of those 425 are staying here locally in the community?
Well, the majority of them, it depends on what you say locally. I can tell you, the hospital up the road has 199 healthcare positions open. Majority of them are RN positions. And so there's a huge need in this community for that. A lot of our students then do go on to Gainesville to work and so forth. I will also tell you, a lot of our nurses are going into, once they locally, which has become a big phenomenon, is to do the traveling nursing situation for 2 or 3 years, that they can make lots of money in this environment.
Thank you.
Any questions for Dr. Barrett?
Thank you very much. Thank you for your time. Sorry about the lateness.
Brandon, I have a question.
Okay, we're not in the question and answer part right now, so we're gonna.
What are his questions?
We'll get to that. Before we go on to the next item, cooling tower, we need to decide if we're going to accept, decline these 2 proposals that were not submitted. previous deadline.
I make a motion that we accept both of them for consideration.
Second.
Got a motion and a second. Any further discussion? All in favor, signify by saying aye.
Aye.
All opposed, that motion carries. Third item, the discussion of possible action, the replacement of cooling tower number 2. Mr. Williams, would you like to introduce that?
Yes, thank you, Mr. Chairman. We need to replace cooling tower number 2, which is located at the main hospital. In accordance with our procurement policies, this is an item that we would need to quote. We obviously would like to have 3 quotes, but as you can tell from the agenda material, we were only able to get 2. That's not really uncommon for the market that we're working in today. And even only receiving the 2 quotes, you can see there's a substantial difference in the pricing. We believe that the Taylor HVAC Services, Inc. Quote in the amount of $3,863.02 is a very reasonable quote given the conditions, and we would ask for the trustees to approve that quote for the replacement of cooling tower number 2.
Question on those, help me, what is the difference between an estimate and a proposal?
An estimate and a proposal are really the same thing for the purposes of procurement. Now, obviously, they have different meanings or could have different meanings outside of procurement. But in this instance, they're the same.
Thank you.
Is there anything that would make it the difference in these 2 quotes? Do we have any idea why? I don't think there's.
Mr. Chairman, I really don't have an answer for that other than to say we see a lot of strange things in pricing today. There's really no explanation I can give. My guess is one had them sitting in the warehouse and had not adjusted the price. The other maybe was going to order it, get it in. Who knows? I'm guessing. I don't know. But there's nothing at all about pricing today that's reasonable.
For what it's worth, the 2 scopes look just about the same. I mean, aside from some verbiage, I think Dale's probably spot on. My joke is, I can't believe you got 2.
Yeah.
Entertain a motion.
Motion to approve the replacement of the tower and select Taylor to do the work.
Second.
Motion and a second. All in favor, signify by saying aye.
Aye.
Opposed, that motion carries. The unfinished business.
I have something for new business. I would, after reviewing the information that we received, we only had one party interested in the Bedoya building. And so that they can get busy on the reason they want the Bedoya building, can we go ahead and approve them for the Bedoya building? So my motion would be to approve CARC for utilization of the Bedoya building, according to what they submitted.
Mr. Williams, just to make sure there was no other proposal that would be interested in that building.
No other proposals specifically mentioned it. Some of the faith-based proposals said they would put programs in there, but what CARC is requesting is a temporary use of the building in order that they can move operations from their current location while they renovate. Now, I have told them that that building has lead paint and asbestos. So they are walking into this, or they're entering into this with full knowledge and disclosure. I don't know what that means in terms of what they may have to do, but it's a building that we honestly have scheduled to be demolished. We're about to the point we can't even insure that building anymore. It was actually noted on our most recent insurance review. So before it's repurposed, before it's removed, if CARC can use that building, I certainly see no harm in allowing that to happen.
Other comments on?
It's not on the agenda.
It's
No,
not.
it's
No.
not.
Or is it just on by magic?
Sorry.
It's on the workshop agenda, right? It's the workshop. All these things were- all of these
No, my
things.
motion is not anything to do with the workshop.
The proposal.
I can't make a motion.
Maybe you can talk to your attorney, I'm the attorney. Not on the agenda.
We
Or just-
act on this tonight, or
Pardon me?
can we act on this tonight?
If you're looking to what I understand is kind of like a bifurcation, because only one entity is interested in in the part of a solicitation. I would encourage that it either go on a regularly scheduled agenda or it be added for and state the urgency.
Could we move it for action to the next meeting? That way it's,
Absolutely. You can ask the director to put almost anything on the next agenda.
that solved the problem.
It doesn't expedite their being able to do what they need to do.
Uh,
Have they expressed when they would be interested in the building?
Well, I'm assuming, I don't know this, but I heard from the director this past week, and I think that things have moved up for them and they're ready to move, and I'm guessing that Ms. Chauncey heard the same thing.
And they're taking it over would only be probably a couple months at the most.
Making that motion with urgency?
Yes,
What's the urgency, please? If the emergency's gotta state what the emergency is. You just can't say it's an emergency. You have to state what the emergency is.
I think it was urgency that, it's urgency because there's no other interest in it. They have expressed interest in it and their plans have moved up and accelerated.
So 2 weeks would make a difference, or a month, 4 weeks?
yes,
Using or renting?
yeah.
Can we hear from
We don't know.
them?
I'm with the worship, Matt Ganscott with the worship room, and we had given a proposal with interest in the Bedoya building. I'm not sure if that had gotten considered.
But again, this is not permanent.
Understand.
And secondly, now this is, as the director, I would never recommend to this board that they lease out a building with lead paint and asbestos. Why CARC wants to deal with that, I don't know. I think they're pretty much without other options.
It might work out to where they get in and use it, and then we
Exactly.
use it afterwards.
Exactly.
Possibly.
Yeah, I do think it's longer than 2 months, but it's not an extended period. That they wish to use the building until they can finish renovations at their existing facility.
And we know no matter what, it's going to be temporary.
Any public comments?
Would this be, if this were to happen, is it rent free? Do they make the repairs? Do they cover the insurance? Do they cover the taxes? What does it include? If the CARC wanted it,
If they want to use it, they take it as it is.
do they pay money? Do they pick up the cost of insuring that building?
They're gonna have to at least the extent of their operations. Now, obviously, because the title is still held by the authority, we would still insure it for general liability purposes in case something were to happen and we would become a joint defendant in a suit or a claim. My recommendation would be to not charge a lease for that building they're going to have enough upfront expenses for the time that they're there, that it would more than compensate for the time they're going to use it. Plus, we're spending money on it now that we could forego.
Okay, if there's asbestos and there's lead paint, they're not gonna come back to the authority and say, hey, this is here.
Well, I would hope not, but if they do, the authority certainly has the right to say no. And again, I don't know how much clearer I can make it. The building has it in it and you've got to deal with it.
We've got our general contractor here. If asbestos is not disturbed, does it create a problem?
Barbara,
Ms. Lindley,
I
do you have
said
another
they can
comment?
take it as is.
I know, but I'm asking the general contractor a question, not you.
Ms. Lindley, this is the time for comments.
Yeah.
It's not a question and answer session. I'm sorry, but this is the time for comments. So if you have any comments about the motion that's on the floor, we'll gladly hear those.
Okay, thank you.
Yes, ma'am.
I would tell you, I'm not a medical expert,
Okay.
but it's not friable, so don't run us off of it.
Yes, sir.
Thank you, Mr. Chairman, Stuart with Columbia County Observer. I just write stories. So if I get this right, there's no state of emergency, there's only an urgency. And this can't wait. And the public hasn't heard from the person that is in charge of Clark. We all know he's a former county commissioner, so that gives him some inside tracks to things. The manager said he had spoken to him, I guess, just recently heard from him, I think he said. I think he needs to be here in front of the board, explain what the problem is, so the taxpayers of Columbia County who've been supporting that building all this time have an idea what's going on. This has been the problem with the hospital authority for the last, ever since CHS left. There's no plan, there's no strategic plan, there's no outline of a plan. Is yours zip nada. And now you continue today, your attorney, and I'll just have to listen to the audio, where he says, I wasn't sure what he said, you could call it an urgency. You know, if you have an emergency, I mean, Robert's rules, which you go by, you gotta, or the city goes by, you have to state what the emergency is. Now you're saying it's not an emergency, it's an urgency. So I'm totally confused, Mr. Chairman. And having been watching the hospital authority since about 2006, I say this is a few weeks premature. And I think maybe you need to hear from Stephen Bailey to see exactly what they have in mind as a respect for the board and a respect for the public who's been supporting that building. Thank you very much.
Chairman.
Yes,
I didn't intend to speak on this subject matter. I don't want to get in the interference business with CRAC and whatever the board's pleasure is and some of the comments. But can somebody on the board tell me what it is that CRAC does?
Provides rehabilitative and job opportunities for disabled.
Disabled. My sister has Down syndrome. I knew that, because my sister
Yeah.
used to attend, but I just wanted to make it clear for the public that you have some people opposing an organization that helps the disabled, the unfortunate people that were born in this world handicapped, that's trying to live a simple life as other people. They're asking to go in a building that y'all surely don't want, plan to tear down. If they're willing to take it and to help temporarily provide services to a group of a class of people that can't help the way that they are, I think that compassion at some point you can kick in and say, we got a building that we don't want. To hell with some of the negative comments, let's just do the godly right thing and say, let's give them this building, help them out until they get their building repaired. They're going back to their home, they're just using it temporarily. I mean, how would we make these people homeless and not have a place where they can function and they're already disabled? I mean, some things we shouldn't even entertain, some things we should just do. And this board hopefully will just do the right thing, give the building to these folks, let these disabled folks do what they need to do and live life normal as possible and have a place temporarily to be at until their future home is repaired.
I do want to make a comment, make it clear that we do know their plans and their intent, as there was a proposal submitted. Basically, the site would allow the clients to still have the training, provide ample space for the administrative staff to carry out their daily tasks and be nearby to support client services as needed. So we do know what the plan would be with the building based off the proposal that they submitted.
And in the meantime, we'd have one facility occupied. You know, that's better than we got now. And it would be for healthcare. And thank you, Sylvester.
Any other comments? We have a motion
I'll
on
second.
the floor in a second. Sorry.
If you restate the motion to make sure that it's clear that the director is to negotiate a lease as the proposer requested.
Restate the motion that the director negotiated lease, which is what they have on
Well,
there.
can we first vote that we're gonna do this and then I can do that? Or do I have to restate the whole, withdraw that and then restate the whole thing?
You can add it, or you can do them both at the same time. If you'd
Okay,
like to
I have an
finish the motion.
addendum to my motion. That the director negotiate the lease.
I'll second that addendum.
Motion and a second. Any further discussion? All in favor, signify by saying aye.
Aye.
Opposed, motion carries. The unfinished business. Yes, sir.
I haven't had an opportunity, I know there's a way to go about it, but I was wondering if maybe I could just present what we're interested in the building for. I know we have a proposal we've already sent in. I would just kind of like it to give you guys a face, give you the opportunity to see what we're interested in seeing. How this is probably the last meeting before things are starting to be established, right? Do you mind if I just speak on what we're interested in using it for?
and I think there will be a time for that. The only reason that we had the two presentations tonight is because their proposals weren't in with the other ones. So there will be a time for presentation. Am I correct on that, Mr. Williams?
Yeah, that's the board's prerogative. So if you wish to give people time to speak at the workshop, you can.
Well, even in future meetings.
Oh, yeah,
after the
absolutely.
workshop,
Yeah, sure.
there will be time for presentations. The two tonight were simply because they weren't formally submitted,
Yeah.
so to be added to the proposals. Is that okay?
You're staying for the meeting, right?
Any board member comments before we adjourn briefly, before we start the workshop?
This workshop.
All right, we'll adjourn and we're gonna take a few minute break so we can switch and take over and resume momentarily.
Do you mind if I go to City Hall?
Are you going to bed?
You don't want to
All right, you're on,
Yeah.
hey, you're on Zoom and YouTube right now.
You can unmute when you're ready.
I just did. That's good to go. All right, we're starting the workshop. I want to make sure that it's known that the workshop, there will be no official action will be taken at the workshop. This is for discussion purposes, brainstorming, and to learn. Because I'm thinking myself as a decent guy, I will entertain comments at the end of the meeting, but we will not have public comments throughout the meeting. I want to make that very clear. And at this point, I will turn it over to Mr. Williams.
Thank you, Mr. Chairman. This is the workshop portion of the March 14th, 2022 Lakeshore Hospital Authority meeting. The purpose of the workshop is to advise the board of the responses that have been received in reference to the request for proposal statement of interest that we issued. And we have, of course, attached some additional materials which we want to present, not so much that the authority board needs a refresher course, but maybe some members of the public may not have been aware of and sort of have an understanding of the confines that we work under. Now, having said that, we will be using the screen. So if you want to reposition yourself where you can better see it, that would be the time to do so. And as many times as we've done this, I've never participated in one on Zoom, so hopefully we'll get it right for those people that may be logging in to view the meeting that way. So having said that, Mr. Chairman, can you give us a slide? By the way, what we will do here this evening, this is sort of a condensed version hitting highlights. All of these materials and much more information can be found on the Lakeshore Hospital Authority website. If you're looking for additional information and you have not looked at the website, please do so. You will find considerably more material than what you'll see on these slides. We published what we consider to be workshop materials. This is what we're going to be going through in a little more detail. If you would, Mr. Chairman. It all begins here, obviously, as an independent taxing district. The authority is created through statutory law. They have specific powers and duties. These powers and duties are outlined in Section 7. And no need for me to sit here and simply read it, but the authority has broad powers as it relates to providing medical and medical type facilities. They have the power to issue bonds. They have the power to hire all kinds of staff, including doctors and specialists. They have the right to lease. They have the right to maintain buildings. But whatever it is they do, they take their charge from the laws of Florida. And so whatever we end up doing as an authority has to be done in conformance with the law. I think that goes without saying, but certainly it is worth repeating. You would, Mr. Chairman. As an authority, we have a mission, a vision, and goals. The mission is to provide quality healthcare services for Columbia County residents through Shands Lakeshore Regional Medical Center and other providers designated by the authority. Again, the vision basically states that we want to be highly visible, that we want to provide high quality medical services, that we wish to try and do the right thing by those in the community that need assistance. And we're going to use the financial resources available to us to do it. And I think the more important thing for the purposes of the workshop are the goals, if you would please, Mr. Chair. These are the goals of the authority. to serve as responsible stewards of public funding and providing for medical needs of the region, to provide affordable, high-quality medical services to residents of the region, to be a positive presence in and contributor to the downtown area of the city, to develop and maintain a hospital complex that supports a full array of high-quality medical services, and to meet the medical needs of indigent residents throughout the region. And of course, you heard a couple of presentations, very brief presentations tonight. You heard a number of those goals mentioned in those presentations. Also, for people that we had already received responses from, if you were to go back and read those, you would see those goals outlined in those proposals also. As an authority, when we're looking at improving the overall healthcare, we look at what the region or the area needs. And of course, we as an authority don't go out and do independent studies and surveys on our own. But the best source of that information that I know of comes through the Columbia County Community Health Improvement Plan. There's a number of partners in sponsoring this. But basically, they go through a pretty tedious, lengthy process, speaking to healthcare professionals, people who need healthcare services, providers, and et cetera. And from that, they draw some conclusions. There's the entire health plan is in or on the website. If you've never looked at it or read it, I would encourage you to do it in its entirety. There's a lot of good information in there. Some of it won't surprise you, but I think some of it will. But, they've broken down in a summary what they consider to be strategic priorities. The first is access to care. And you can see under access to care, they have 3 goals: increase the appropriate use of healthcare services, increase access to dental care, and increase access to healthcare services. They also have strategic priority of mental health promotion, increase the awareness of services for behavioral health and substance abuse treatment and prevention, and improve access to resources for treatment and recovery. If we look at those 2 strategic priorities, again, we get back to the goals and we get back to the overall mission of the authority. So those are certainly things that have been identified as being community needs that this authority board can look at and discuss as they go through trying to decide the best uses of the authority resources for the Lakeshore Hospital campus and beyond. This is a little bit more information about access to care and mental health promotion. Again, I don't want to just read it to you, but if you're looking for a little bit more detail of what those things mean and why they're important, they've actually added some additional information regarding that. And so I would encourage you to look at that also. Okay. Here is some additional information from the Community Health Improvement Plan. Deals with various things, factors, trends, and events. Again, you might find some of this to be interesting or new, things you might not think about. But when you read the entire document, I think it pretty much makes sense. These are things that we need to understand are going on in our community that affect what we do in terms of healthcare. The better and the more we understand these, I think the better decisions we can make as an authority in trying to meet these needs. Keep going if you would, Mr. Chairman. All right, let's talk about the Lakeshore Hospital campus. I don't think I can quite see the numbers on them, but the bottom right, the big blue area, that of course is the main hospital. And then, of course, the blue area right above it is the parking area. The little brown building to the west is what we just referred to as the Bedoya Building. That building that's green right below it, that building is the PT Building, also sometimes referred to as the Reyes Building. Another parking lot to the west of it, and then south of that, we go down. That is the building I call the Women's Center. It's sometimes called the Medical Plaza. And then, of course, the building that you're in, one down, go down. That's the building you're in right now. And then, of course, directly behind us is a medical services building. There are other ancillary buildings on this campus. Back to the far east, you'll see a few little buildings we didn't identify. They're basically facility maintenance buildings, storage buildings, and et cetera, but they are part of the campus. Next one there, Mr. Chairman. Okay, so we have this inventory, and of course, you know, we've got a set amount of square footage that we can work with. So how much do we have? Well, the main hospital has 112,270 square feet. The building that you're in has 12,300 square feet. The medical records building, again, just behind us, has 3,400 square feet. The Medical Plaza North, which I referred to as the Physical Therapy Reyes Building, has 7,180 square feet. And then the Women's Center, or the Medical Plaza South Building, has 11,000 square feet. What the goal and objective of the authority is going to be is to take the proposals received, identify how we can best meet the needs of the community in accordance with the law that we operate under, and our missions, our values, and our goals. If you want to look at it as one snapshot, that would be the big picture. That's what we're trying to accomplish. And again, there are some ancillary buildings. We have the facility and engineering building, a groundskeeper building with a shed, a storage building, and we didn't include the Bedoya Building above in the square footage, mainly because of its current condition, but it is an ancillary building. All right, we did receive a number of responses, and of course, we added 2 tonight. But again, the entire response received is available on the website. So these are just summaries, just where people will kind of have an idea of what we're going to be working with. We talked earlier about CARC, and again, they requested short-term lease while the current facilities are renovated. And based on the action of the authority, we're going to go ahead, separate that. We'll start negotiating a lease for the use of that building. Columbia County, and here we're talking about the political body, Columbia County, through the Board of County Commissioners. They requested space to create a one-stop shop for the creation of a combined city-county permitting office. They were looking at some additional parking and space to possibly build a new meeting room. Again, that comes directly from the county. Below that is the public health unit, which is also they are a recipient of county funding. The public health unit is actually, those are state employees, but they're located here. They do receive a significant amount of county funding, and they're seeking additional space to provide their current services. They're willing to discuss a partnership with the authority to provide primary care service and dental services under the authority's medical assistance plan. Compass One Healthcare, they're basically a large provider of various medical services. They would be seeking a contract. They can provide food and nutrition services, environmental services, facility maintenance, biomed services, and I'm sure there are others. Meridian Behavioral Health Care, obviously we're familiar with Meridian. They seek an affiliation with the authority and a lease for the Lakeshore Hospital facility for the purpose of community-based inpatient behavioral health hospital and integrated health home facility for the county. They submitted a pretty extensive, pretty detailed submittal, and of course, again, it's available on the website, and I encourage you to read it. Multi-Specialty Research Associates, they're seeking the leak space in the hospital facility to house clinical research. They are currently located on US 90 West, I believe, but they're out of space. Remnant Ministries is a faith-based organization seeking to use the hospital campus for substance abuse, homeless care, adult mental health, children's mental health, youth and teen programs, and other services. And they have laid out pretty much a building by building use. Again, that's part of the support material on the website. SCP Health is another contractual opportunity. SCP actually provided services to the old community health system when they were operating Lake Shore. That is who actually ran the emergency room. It was actually SCP. But as you can see, they're interested if we want to get back into full emergency services, or even if we want to have them staff some medical facilities, they do that. The clerk of the court is asking for use of the record storage building. That would be for public records. I think if I remember, the public health unit also was requesting room for public record storage. I think those were the only two that limited themselves to that building. The worship room, another faith-based organization seeking facilities to perform counseling, community engagement, networking, transitional housing, mental health, youth activities, long-term care, and other services. And then we have Your ER Solution, LLC. They want to partner with the authority to create an acute care facility, including on-site radiology, IV fluid and medication administration, and performing standard emergency room procedures. This was submitted by Dr. White. Of course, Dr. White was the ER director for the medical center. So they have basically indicated they would like to work with the authority to create an acute care center. And so you already know it, just to make sure, we added the two tonight. One, of course, from Haven, Mr. Peacock's presentation, and the other from Florida Gateway College, Dr. Barrett. This is where I think we really get right into what and how we are going to work and what we need to do. Some of you are familiar with a SWOT analysis. You can use other ways in which to sort of approach this. This is my opinion and my opinion only. There are many things you could add to this. You may disagree and want to take some things away. But I think the strengths that we have right now is we do have facilities and we do have financial resources. It's not like the cup is bare. It's not like we don't have anywhere to go but down. There are some tremendously good facilities. There is some very significant financial resources. We just need to make sure we use those facilities and resources to best serve the community. As far as weaknesses go, I think the biggest one we have deals with the actual hospital. What I see as being a weakness there is it has centralized mechanical and electrical configurations. So if the authority wanted to put 4 people in there and they wanted everybody to pay their own utility bill, I don't have a way to do that. I don't have a way to do that. So it can be done. I just think it's terribly expensive. So that's going to be an issue that we're all going to have to sort of figure out, what, depending on who the end user is, how we can do that. The other weakness that I did not list Excuse me, it's under threat. We'll get to that. Opportunities, obviously, we have an opportunity here to do two things, and I consider both of them to be extremely important. One is we can enhance the current level of community health care. We've heard numerous instances just in the verbal presentations. We've heard and seen numerous instances in the written documents that have been submitted. I think we really have a chance here to do something good for the community. And that would be obviously part of the goal. We do have the medical assistance plan. I think the medical assistance plan is way outdated. I'm speaking as the director, not as the authority board. We have had some brief conversations about it. I think there are things that we can do that enhance the medical assistance plan. I don't think any of us would disagree that 60 is way too few people, given the unmet need in this community. But there are reasons that it's at 60. It's not that only 60 people knock on the door. It's the people that knock on the door that don't get help, and whether we're turning them away for good reason or not, that we need to concentrate on. There are threats. Time, you've heard time mentioned here at least 4 times tonight. You've been doing this since whenever. You hadn't done anything, or you didn't do this, or you didn't have a board or whatever. Time is a threat. We all acknowledge it. We all know it. I think a threat is the building renovation corrective work cost. We have estimates for doing roof repairs. We have estimates for doing improvements to keep walls from seeping water at the main hospital, which is the most significant of the cost. We do have some renovation expenses that we need to address even on the PT building. It needs a new roof and it needs a new air conditioning unit now. We have those estimates. When we sit down and start talking to those that have submitted proposals, we think we have enough information that we can have a good dialogue. We heard people talk earlier about what are the true operating costs of these buildings. If you go to the material on the website, Dwayne, where's Dwayne? There's Dwayne. Dwayne's the facilities director. Dwayne has broken out electrical costs by meter. He's went back, even though we didn't have privy to records of the old hospital operator, we were able to go back and obtain some information. So you kind of have an idea of what with load, with people in it, it was costing per month. And then you have, we know what it's cost vacant. So we have data that we can share. So when we get the chance to sit down and start talking about what the, how those buildings can best be used, and you people that are having to consider whether it meets your business model to move in there, we have data that you can use to help make that decision. So we don't want anybody going in blindly. We want to be transparent. We want everybody to understand what is good and what's not good, what can be fixed and not going to be fixed. But I think we're to that point. We have that data. But those were the things that I considered to be the threats. Now, having said that, once again, I think the goal of the authority is to take these proposals, look at what our community needs are, look at the framework that we work within, which is primarily the laws of Florida, along with our mission, values, and goals, and see what we can do to use the strengths that we have to meet that community need. And that's going to be the art of it. And I personally do believe what was said earlier. I believe that partnerships and relationships play a big role in this. I have talked to a lot of healthcare providers in the past year, a lot of healthcare providers. And the ones that are successful are the ones that are collaborative. Every one of those collaborative efforts were very successful. Everybody's not good at everything, yet some things have to have other services in order for them to succeed. And I think maybe when we get through, we might find that that works for us too, that we would have a collaborative effort. And we're going to hopefully have a good plan and program for the community as a whole. Now, this is just getting started. There's a lot of discussion that has to be had. I'm gonna pick on you, Don. There sits Don, Don's Meridian. They have an excellent proposal. They meet a lot of those community needs, but Don don't know yet all that he needs to know in order to make sure that it's something that they can in fact do. And that's the reason these statements of interest were not binding, but it does open the door that we can now share information with Don, and Don can get with his people. They can start crunching numbers. They can ask the questions and get the answers that they need to start making more definitive answers. Same thing holds true with Dr. Barrett. Same thing holds true with Mike Peacock and et cetera, and anybody else that submitted a proposal. I'll be glad to answer any questions you have, Mr. Chairman.
Trustees have questions, comments?
Yeah, thank you.
To expedite this, and I think, again, I'm an accountant, I think the biggest thing that's totaling is the operating expenses of the empty buildings. But from looking over at the proposals, it seems like they could be classified as to which building. So you could ask your executive director to make a table or a chart that that lists the organizations that want specific buildings. And then the board would have because hopefully your objective is to get all the buildings occupied and to have the authority at least become neutral as to spending recurring money. That might be a way to start ranking and reviewing process, as opposed to, because there's some that want everything, some that want one building, some that want other things. So to kind of make it always use apples to apples, or that, so that possibly he could come up with a ranking of classification that utilizes all the buildings. And then the authority board could go from there as far as deciding. And again, time is of the essence, because while you have good reserves, you don't have recurring funding coming in. So when you're operating off of a corpus, it has to go down if you're not bringing in revenue. And I haven't talked to Dale. I just
Please.
You sure?
Compass and your ER solutions are more for services. They're not necessarily wanting to lease or purchase.
Which one?
Compass and your ER solutions, is that correct?
No, your ER Solutions wants to partner with the authority.
To operate an ER.
Yes. Yeah, they want to do an acute care center and they basically want to participate with you, particularly utilizing the medical assistance plan.
So Compass would be the only one, they're not looking for a building, they're looking at.
Compass and SCP, they're only doing contractual.
SCP, that was it, thank you.
Yeah, SCP.
Well, I like Mr. Howell's suggestion. I think it would be helpful if we could see that, you know, a chart or table, something that shows building 1, 2, 3, 4, however we number it. These are the proposals. This is who is interested in what buildings. No, I don't see a scenario where we can make all 11 proposers happy by utilizing all of their proposals. There would definitely be some overlap, but I'd like to see, just like CARC being the only one interested in the Bedoya building, and there's 2 people that are showing interest in the storage. And they need all of it, and we cut it in half, put a wall up, and you know.
Yeah, well, again, until we have the opportunity to sit and question each other, it's really, I mean, we know what they're looking for in general, but not specifically.
Brandon, unless we change what we have previously done, if they don't have something to do with healthcare, then they can't have anything we got. That was established years ago, I think with the original authority. Something to look into.
Yeah. Everything.
How long is that, like, would we have to wait till the next meeting to do the grid, who wants what, or when, why?
I can't hear you.
We have to wait, I'm assuming we have to wait for the next meeting to get the,
Well, I think Dell's even saying that we may need to talk to them more in depth to figure out exactly what it is they're wanting also.
Okay.
We, going by the proposals, we can kind of piece together some of it, maybe not all of it. For instance, Mr. Peacock, had a proposal, but he said that he may be able to work it out with somebody else as well. So I mean, once we really dig into it and start digesting it, hopeful that we'll be able to come up with some sort of plan that works. Utilizing all the buildings, maybe not by one person, obviously, but if multiple proposers can coexist, cohabitate.
Well, for what it's worth, just my observation and opinion, we have much more opportunity here from these proposals than we did from the first set of proposals. I think, first set of proposals, we just didn't have this much of a broad stroke, a broad brush with this many services at play. We had a couple of people that wanted to do like an acute care thing and contractual work, and didn't have as much opportunity from proposers.
What building did the county have interest in? I know there was some land.
Bedoya. No, I'm sorry, Reyes, the PT building.
And then some land as well, right?
Yeah, they were basically looking for the PT Reyes building, the parking lot, which is, of course, is between this building and that building, and the Bedoya building, only to have the Bedoya building removed and to build a meeting room there.
They wanted to do that with the city.
These are the top results.
Yeah, they basically are through an interlocal agreement seeking to have a joint partnership with the city for permitting, building and zoning and et cetera.
And that's what would require changing everything with the authority. Because they're not medical.
All I can say, Miss Laurie, at some point, you're right. I think at the end of the day, you have to kind of look at everything in total. Now, there are other laws that clearly say governmental entities can do things for other governmental entities. I don't know if they trump the laws that created the authority or not, but
Well, now, it wasn't a law that created the authority. It was the original trustees that said nothing could be done outside the medical area.
they did that as a matter of policy.
Yes, I mean, we can change it.
Okay.
Yeah, I'm not saying that. I'm just saying that presently,
I guess all I'm trying to say is anything we do is obviously going to end up with some form of legal review.
Yeah.
Because, we do have statutory guidelines that we have to work within.
Just to be clear, the health department was wanting the storage building, the 2-story women's center building, and this building.
Yeah.
Is that what they're interested in?
Yeah. And they're looking to expand services as well as, what they currently do.
If we don't have a full service hospital campus here, there's nothing that says this office authority must be housed in this building. I mean, we could.
No, in fact, I think that's part of what happens when it comes to the medical assistance program. I think the program needs to be at point of service, and we're going to have to talk about that. It never really made a lot of sense to me that just use the example with the hospital. They had somebody they knew would qualify, and then they asked them to walk down the street. Well, they don't. They go to the car and leave. But if we were there, I think it would make things much more convenient. So I think even that type of discussion we need to have when it comes to the medical assistance plan. I think this building's in play, is what I'm saying. The final decision will be the trustees, but as far as I'm concerned, this building can be in play to meet these needs.
I'm kind of going through each one just so I can play it through my head. And
Sure.
Make sure my notes are right. Meridian is interested in the main hospital building, any outlying buildings as well.
I don't think so. I think 100% of what they were seeking is the old hospital.
And from the last time that you were here speaking, I think it was 3 floors is what you were looking for.
Yeah, since then, we've spoken with BCF and ACA. There's a lot of need up here, and I put letters of recommendation from the district director and DCF and Lutheran. They want to expand services. We could fill that building. And just for reference, the campus we have that we've been in since 71, we've outgrown it significantly. Part of our plan was to find some land, possibly float a bond and build a hospital. The costs have gone through the roof. We don't see that as feasible right now. This would be a golden opportunity to expand psychiatric hospitalization to Columbia County, and we'd be the only psychiatric hospital except for Gainesville, Tallahassee, and Jacksonville. What's that? Well, Memphis is an inpatient commitment hospital. It's not the same. Yeah, we're an addictions receiving facility as well. And so, and we'd be putting an arm in here and we'd have 66 rehab, 68 rehab.
My understanding is
What's the county one?
multi-specialty is interested in one floor of the hospital building.
Yeah, they didn't specifically say one floor, but you certainly got, it was implied, I guess. That's what I took out of it. But, you know, they are the type of agency that if anybody needs blood work, I mean, that's what they do a considerable amount of. So you get back into potentially having a collaborative effort with some of these.
Mr. Williams, I think it would help me a lot more. I appreciate your slideshow. It's very informative and broke down the actual proposals, but if maybe to give you some additional work, I hate to do that, but could you maybe do as you did on the slides and kind of list each one of these proposals and again, in addition to the building they're looking at, the square footage that they're actually requesting if they have done so in each of these proposals. And maybe a note from you as to how each one of these proposals would go to somewhat achieve the mission, the vision, and the goals of the authority, if any.
Yeah.
And include Dr. Barrett's from Florida
Sure.
Gateway College, as well as Mr. Peacock's proposal that we had tonight.
Yeah, that exercise, we've pretty much started at least in the very early stages of it,
Yes, sir.
which is kind of why I know that I'm gonna have to meet one-on-one with some of these to try to get a better understanding of
Yes, sir.
exactly what the space requirement is. Ask a few questions, let them ask a few questions of us. Look, we had a entity interested that did not submit a proposal, is not asking to be added. But they came over, we met, they asked some questions, and when they got through hearing the answers to the questions, they just simply decided it wasn't for them. And you may have some of these that propose that may do the same thing. I don't know if at the end, they're all going to be in play or not.
I apologize. I haven't read all of these proposals.
That's
I've been out of
okay.
town and just got them. I plan to do my due diligence and read every one verbatim.
There's some good ones.
Yeah.
There's some good proposals. And
And then I
again,
may have need some time with you as far as
sure,
Q&A.
sure.
Do we have any idea of what the lease amount we would be looking for?
All right, we have worked on a lease rate study. Here's what I can tell you. In the Lake City market, full service leases, the least expensive full service lease that I could find anywhere was $28.50. And full service lease is basically you provide everything for them. They just want to write a check. And everybody I talk to, such as the people out at the Professional Plaza across from the Highway Patrol, those rates are about to all go way up, just part of the inflationary spiral for many reasons. Now, non-full service leases, the least cost per square foot I found was $8 a square foot. That space is for the most part very sparse. It's occupiable, but there's nothing fancy about it. And then it goes up from there. And you can find some non-full service leases hitting $20 now. So wide range of market rates. Tend to be trending upward, which really is regrettable, but I don't think it surprises anybody.
Okay, now the non-full service is just space, no utilities, no repairs, no maintenance.
They basically rent the space. There are, it's kind of like the old leases you've seen. The landlord will identify a few things that are they covered and everything else is yours. They're not gonna go in there weekly and sweep the floor, vacuum the rug, empty the trash cans. They're not gonna furnish you soap, paper towels. They don't do any of that.
Okay, but now, and then you can go anywhere in between, like rent out the space and we'll pay the utilities.
Yeah,
Am I correct?
that's correct.
Okay,
Yeah, at Duval Place, they're currently charging, if you want the utilities included in the base square footage, they are charging an additional $2 a square foot, but that's about to go up.
What was the square footage of the hospital?
117,000 or something like that. And look, of the 117,000, that's not all office space. I mean, you have common area, equipment rooms and the like. You're probably gonna lose at least 20% of it. But we do have cut sheets, detail sheets. So for example, if I'm sitting down with somebody interested in the hospital, we can produce floor plans and et cetera. People can make plans.
In our last lease that we had, there was always a discrepancy on who was responsible for what. I would rather charge the bill and rate and us be responsible, have a facilities team that maintains the building. That way there's no question. If that's the way we go with the leasing the space out, I would probably be in favor of going that route.
Well, I think we all agree that what we previously had at some point stopped working like it was intended. And whatever we do not want to repeat that. That would be the goal. So I certainly agree with you.
I don't think we were able to enforce that last one. And it came to the thing, there was no teeth in there for enforcement, no oversight.
Can you speak up?
My bad, I'm sorry. I said there was no enforcement in that last one. There was no ability to enforce. Nothing clear, in my opinion.
Next steps.
Yeah, where do we take it from here?
Well, what I would like to advise the board is, first of all, please contact me with any questions or concerns you may have, thoughts or ideas, but I'm going to start contacting those that have submitted proposals. I'm going to try my very best to come to some understanding or at least a better understanding of their proposals. Do exactly what I've been asked to do, and that is to try to put those proposals in the best location. See what kind of a program we can create. I'll be more than glad, as requested, to identify those that and what goals of the community they meet. If that makes your job easier, I'd be glad to do that. But I don't think we can do much without taking that step. Otherwise, we're guessing.
When do you think we could have another discussion, presentation on that? Is May too early?
I don't think so, Mr. Chairman. I'd hope it could be before that. I mean, I can't control other people's schedules, but I'll make myself available more towards their convenience than to mine. And, you know, some of them's going to result in follow-ups. I mean, we're going to sit and meet. We might have to meet 2 or 3 times before we get to where we need to be. But then I'll summarize it, present it to you, along with other information you may have requested, and hopefully we can start making some decisions. It'd be really nice to know what we're going to do before we start putting a budget together for next fiscal year.
Yes.
You agree, Mr. Powell, accountant?
Absolutely. Absolutely, because unknowns are not, the more names is better.
Question marks in there?
I mean, that's not that far off, but I think it's important.
Randy,
Yes, ma'am.
I think if Mr. Williams is able to present everything to us, let's say with a particular building, and the people that are interested in that particular building, let's say, as soon as he can present that to us, we should be able to vote on it. This is not as though it is a package deal. Everything is individual.
Well.
Are there people, are there,
We did have one proposal tonight that could potentially take three of the buildings at least. So that,
Well, yeah, but if for any reason there is a change,
yeah, there's only one, you know,
if there,
storage building behind us.
Yeah.
It's nothing
Yeah.
big, but there's only 2 that are interested in it. If one of them says they don't need it after all, then maybe we can lease that out if it's not.
well, what I'm saying is even if we've got 3 people that are interested in the storage building, then we should take the storage building and decide what we're doing with it. And then that gives us that much less to worry about.
Okay, everybody think that's
I do.
Yeah.
We can get it done.
Yep.
Whatever it takes to move it forward.
What'd you say?
You're mumbling.
I'm sorry. Whatever it takes to move it forward.
If,
I know. I'm sorry, Stu.
You need a Bluetooth mic or something.
Right? It's the pollen.
Yeah.
That's the.
Definitely not trying to put the work on this leads in, but I noticed one thing you go discuss tonight with a lot of counties and different. There's another category of businesses. It's like you said, who wants what building and everything, but let's look at which business has the most economic impact. Decision on it.
Good point.
I promise I'll get to. Before I take public comments, is there anything else to be discussed? Mr. Williams,
Okay.
Ms. Lindley?
In the beginning, it states what the mission is and the goals. I don't ever recall this board approving that mission of the goals. The purpose of the authority was to provide indigent care within Columbia County and to make these people self-supporting. And as Mr. Powell had pointed out, what the purpose of the money is, we can't give money for a building if we're not going to own it, because that was taxpayer money, I paid taxes here for 41 years. It was for the purpose of indigent care. That if it's going to a building, the enabling legislation will not allow that. And I think Mr. Powell kind of
No,
indicated
I
that.
did, for sure,
Correct yourself.
I made some comments, but I did not make that comment or that
Well,
recommendation.
that's,
I didn't speak to that issue at all.
okay, but you're talking about where the money had to go.
No, I'm-
With the
the-
legislation.
The biggest emphasis I've tried to make tonight, if anything, there is a pot of money that is a sizable pot, but there's no new money coming in. And there's a significant amount of money going toward those buildings. So the sooner that is equalized, the better the public will be.
Absolutely. If we're paying $85,000 a month, 12 and 13,000 for the electric and the water, it'd be good. Plus the insurance to maintain the buildings is outrageous. Dale, isn't that about how much a year now?
It's gone down. It's gone down, but you're probably basing that on the last report that was
Yeah.
given. I need to get a new report up, but those expenses are down.
But, I'm all for what Meridian could do, what the college could do, as long as we're not spending some of the money that was allocated for indigent care, even though it may come from the lease.
Even if we took the $85,000, which was a high number, the $7.5 million buyout that we got would last us a little over 8 years. So I don't want anybody to think that we're spending taxpayer money on me. I'm not saying that it's perfectly fine that it's going on. Everybody up here wants to get that reversed and have money coming in. But the $7.5 million buyout that we received from Community Health Systems would last, using the $85,000 a month, would last over 8 years. So
Well,
I just do want to make sure.
I understand that,
that's
but it's
very
all
clear.
taxpayer money. It was.
No, that was Community Health System. That's a private organization.
What we're saying is they gave the authority money.
To
the
buy out their
authority-
lease, which was not
The
taxpayer.
authority
money.
belongs to the county,
But it
so
didn't-
therefore it's all.
But that
our-
wasn't taxpayer money. That wasn't ad valorem taxes.
No, but
that
once it
funded
became into the authority,
It's public money, but
it's public
it
money.
come from a private entity to continue running buildings that are owned by the public. You're right. But it was not taxpayer money.
Even though it was on a taxpayer facility.
Then why am I
Right.
taxed every year?
You
We
have in
weren't
the last
this
2
past
years.
The bottom line is we just need to get rid of the buildings whichever way we can without expending any kind of money for them. Thank you.
Thank you.
Thank you, Mr. Chairman.
Yes, sir.
Stu Local, again, Columbia County Observer. I have a couple questions. All right, stories. So tonight, you mentioned that you're gonna do some legal work, some legal analysis. 2.5 years, or how since October, or whenever it was, we knew that CHS was leaving before that. And now, you're gonna do legal analysis of what the legal requirements are for the hospital authority? What took so long? That's one question.
Well, first of all, let me answer your
It's up
question.
to you.
I do not know of that which you speak.
What's that which I speak?
What I said is based on the proposals that came in, before anybody contracts with any of those, there will have to be a legal review to make sure that we can legally and are authorized to do that. I don't know what that other stuff you said
So the
was.
legal review is only for the proposals.
That's exactly what we were talking about when that
You
was
were talking
mentioned. Exactly.
Right, not with you. They didn't ask
Exactly.
you. Okay, so the legal review is just for the proposals, not for what the legal responsibilities are for the authority, based on the statutes. And that still stands. You refuse to ask your attorney for an opinion or anybody else. He just sits there, and if he did, he would do it. I see his bills. He writes them. The second thing, and what I would say is, if it's good enough to say, it's good enough to write. If you're gonna ask all these proposers, folks from Meridian, who now want to take the whole hospital building. Now, if they're gonna take the whole hospital building, they may have a use for the storage facility. Believe me, you have a bunch of paperwork. Well,
We're paperless.
they're paperless. unlike the Lakeshore Hospital Authority, but you guys get close. You guys get close.
Oh,
We
it's
have-
public record request.
That's all digital. I'm getting this stuff digitally now.
Okay,
Can't
good.
say you're killing any trees, I answer the request.
We're getting there, then.
So all these questions that this authority, which now is the executive part-time director is gonna ask. And hopefully you'll find time. I know some people are afraid you might get overworked, but you do get paid.
Yeah,
to
I'm
be
getting
here.
old, Stuart.
Yeah, I get it, I get it. Is those questions are gonna be just on the telephone, the way everybody does everything like Stephen Billy did today? Or are these gonna be in writings and the proposals are gonna have to submit their,
Well, first of all,
let me just finish the question, submit their answers in writing?
Stephen Bailey and I did not talk on the phone,
Yeah,
so let's don't,
came into the office,
no.
You said you
Repeat
talked.
what I said.
yeah.
I ran into Stephen and Stephen and I had a conversation,
Fine.
okay? Well, let's keep it,
So you're
what
gonna
was
run into these other
said.
people, or
let's
you're
keep-
gonna call them? or
Most
ask them
of
for
these, I
proposals?
think we need to sit down and talk where we can share information, we can look at schematics, we can do
Right.
those things.
So the hospital authority has been sitting on all these proposals for a week, 10 days, 2 weeks. And that was my question. I'm looking at all this stuff. And I'm looking through the agenda material. And I'm going, where's any kind of spreadsheet that shows what these people want? So I don't understand why it takes this authority to ask the executive director who's been doing this kind of work. Some people think it's economic development, but this is hospital authority work for all these years. And you come to this meeting and there's no charts. I understand Mr. Kennedy was out of town, he didn't have a chance to read the stuff. But you come to these meetings with no charts, no nothing. How is that for this authority? How is that responsible?
We have a.
I got the
Big numbers.
proposals, but you
We've got a
know,
lot of
I
stuff
saw a
here.
little map of the buildings. But you know, each person is, Maria's asking for one thing, the hospital, the college is now asking for something else. These folks sitting over here, wherever you're from, apparently had an interest in the Bedoya building, which is really
But
run down.
you had copies of the proposals from
Right.
day one.
I had them. Where's the chart? Am I supposed to make a chart? Why would I?
No, but now, let's make sure we
We
understand.
can read. Why do we need a chart, Stuart?
They just asked them to do one at the meeting.
No, they asked
No.
for something a little bit
Yeah,
different
okay,
than a
fine.
chart.
That's fine. And the final thing to clear up, when, I guess with CHS, those three letters, I always get those letters confused. with Lindsay Mills, and put out the lease, that money goes into the Lakeshore Hospital Authority funds. At that point, that belongs to everybody. You may be able to run the hospital authority for 8 years based on what was given to you by CHS. But you'd probably be running out of town if you did that for 8 years. But let's understand, you've been doing it for October, how many years is it now? With no plan, no nothing.
A little over 1 year, and nobody said that we wanted it to last for 8 years. I said that money, I wanted to be clear that we're not using money that was collected through ad valorem taxes.
And we do understand that that money can be put into a trust fund for indigent care.
That's right.
And the rest of this hard authority could be disposed of depending on a proposal. Is that right? I mean, there's nobody from the Lakeshore Hospital Authority Board which refused to ask the attorney to make a judgment on. Again, I will mention that. So as far as anybody knows, that's one legal threshold that you have not jumped over. Is all that money really can go to indigent care, should somebody decide that it should go there. And then if Meridian wants to build a hospital, or the college wants to build a downtown campus, they don't need any of that money. Dr. Barrett can get it from the state, that's the thing going on. Meridian just, he told me, the meeting went on, he doesn't need the money for that. They were gonna build a hospital and they could use that hospital. So I don't know what all the proposals are gonna be, but all I'm saying is I don't get that you guys are like really listening really close. And I know I've heard Mr. Douglas speak about the problems with the building. So anybody that wants to take the whole building, that seems to be like a gift from heaven for all the taxpayers in Columbia County and anybody that lives here. So that's what I have to say. And I'm really disappointed in tonight of this whole presentation thing from the executive director and chairman and the attorney, who has generally nothing to say. We got the urgency rule now, which I never heard. Thank you very much.
Yes, thank you. Gordon?
Mr. Chairman, thank you for this opportunity. I've lived in this community for 41 years, and normally you'll see me at city council meetings and county commission meetings, and sometimes I sound a lot like Stu. I just realized that because I'm an activist, so I'm fighting for some things that have been neglected in my community based on race and some other stuff. But as I look at what the authority board has done over a period of a few years, y'all have at least at one point, we're trying to get a hospital in here, and a lot of us were excited and we're fighting with the authority about making that hospital, community hospital, that is full service. And we came to a realization, at least I came to a realization, I think that the community in which I live in, which is this community, have come to a realization that that's not gonna happen. What we do not want to have happen is a building sitting next to us that's just empty, that's an eyesore, that's eating up the money in the account, that's not having a significant impact on the community and the folks who live in it in a supremely and impactful manner. So to see that y'all have come together and have started entertaining proposals, sounds like y'all are getting ready to get some information together and make some strong decisions. What I would ask this board to do is begin to look at, because I heard some of the presentations and I heard some of the things that you spoke about, Mr. Chairman, from some of the other SOIs, that there may be a way that there's some collaborative efforts that can be put into some of the facilities. And I think that works well, as long as this community, which anybody cannot deny that the community which this Lakeshore Hospital sits in, it is a very poor community. It is a very neglected community. It has a lot of bad infrastructure as far as housing and other needs. And to see something significant come that can impact it in a financial way, beautify the area around it, this community would be extremely in support of. One of the proposals that I did here, that I did like, was the amount of financial impact that the college would bring, understanding that the college was open to collaborative efforts. Maybe that's something that, as Mr. Williams look at, he can figure out how he can work with all those entities, hopefully to house them together in some significant way. But to say that y'all have done nothing, and to say that these folks who have presented have done nothing and the presentation was crappy, I think that this was right on time. I think this is what the community wants to hear, that we got some good participants. Y'all didn't make any rash decisions on some of those old proposals, and now we got the right proposals in front of us, I think. And we just need to figure out how we can fit all these folks in these different buildings, get some of this cost off the books, and see what works best in the community. Thank you.
The Zoom call, if you press *9 to raise your hand, *6 to unmute if you have any comments.
Yes, Mr. Beal and board members, my name is Sandra Buck Camp. I've been in this community since 1989. And I have great issue with the fact that you would donate, give, or some other way of giving a large building to the community college so that they could go ahead and get grants. I'm sorry, it's not a community college anymore. I firmly resent the fact that they have the unmitigated goal to ask for a building so that they can get grants and carry on with their educational activities. I don't resent the college because of their interest in wanting to promote the educational activities and have them all located in one particular area. But I do think it's unrealistic for us or for the authority for spending so many years trying to maintain the building and generate the interest in healthcare, whether it was up, whether it's down, et cetera, to just give the building away. I have strong negative feelings against that. Indeed, if that's going to be done, rather than have it be a board decision, I think it should be the public of Columbia County in a voting issue to have a referendum to be able to do that and let everyone decide, not just the 4 or 5 people that I know you're very responsible and you think ahead and plan ahead. But I would like for all the taxpayers to be participatory in that particular action. Thank you.
Thank you, Ms. Buckles.
Can I say something? I will hope that this board don't take anything off the table. Again, I know where I live at. I know where most of these people live at. I know that certain people don't live in this community. So when things don't happen, it doesn't affect them. Right? I don't care what it takes. And I can bring 100 people up here if I have to. I don't care what it takes to get a hospital off the books and to get in the hands of the college or whomever. I don't care if you give all of it away. But as long as you give it away to some people, it's gonna make a real impact on this community that has been deprived and neglected for decades after decades. I'm 41 years old, and this community has been deprived. And this would be a contribution back to the neglect that this community has suffered to give this stuff away, or lease it or whatever. But if giving it away is an option that we can get this done, then I'm all for it. And I can guarantee you, I can line every Black person up in this community who it will directly affect, will be up here and say, give it away if you want to, or if you need to. But we need some real impact over here.
Any other comments?
Respondents that are present, if you were, when you get with Mr. Williams or whoever, when you do your collaborations, I know a lot of people are kind of saying collaboration. I'd really love for that to get fleshed out. Collaborative efforts that's not going to be a small part in it's not going to be a small part in my decision making. But if there are collaborative efforts, I think that should be taken to the next level. Because when, these decisions will move forward, and when they move forward, I don't want somebody to say, wish we'd have thought of that. So if we've got those collaborations, I'd like to see them fleshed out.
That's just one more thing.
Yes, sir.
By the way, y'all, again, appreciate you all, right? Allowing me to come over. And I've listened to everybody, and I've been in a lot of places, and I've been in a lot of different communities up north, down south. I'm country for it, and I get it as well. I think the key thing is going to be the community being served. It's going to be best with the property all the way around. But the most important thing is services that community participate in, and of course, the economic impact that it's going to bring for its jobs and eligible services for them. I'm not saying none of the competitors here with me not doing the same thing. I think what we need to do, and I'm not just making a suggestion, and it take a lot of work off the board as well. We're modern age now. Just take a simple email, send it out to each one of us right now, ask each one of us to do an addendum. That gives me a chance to do more addendum than mine too. Do an addendum and show how it economically impacts you and it's going to impact this community. Because if they listen, it should be easy for them to do because they've done their due diligence. They know this community, they know the demographic and everything else. Show how it's going to bring jobs, show how it's going to bring more resources here and everything else. And that way, he doesn't have to make a charge. You have information from each one of us. And if anybody can't do that, they don't need to be submitting a proposal to you in the first place because they haven't done their due diligence. I really appreciate this.
Board member comments?
As far as our program for the indigent being down number-wise, I believe if we look back on our records, we could find 52 for a number of months. And I believe at one point it went down to the 40s. So we're still doing better than that time. But every time that new medical programs come out, our numbers drop. And if people have access to different things like the child care program, which some people are not aware of, the children can be taken care of. So the adults figure, well, even though we don't have anything, we're not going to go apply for that until they have to. So, I mean, these are things that have to be addressed by the board also. But I wouldn't where the figures are right now with everything that's happening, with all the assistance that's being given out in the last year. I wouldn't worry about those numbers because it'll go back up.
Kennedy? Timberline? Douglas?
Done.
Williams?
Good.
Kyle?
Yes,
Good.
good, no, that's fine.
All right. Sure.